Hi everyone, my name is Dr. Lynn. I'm a consultant pediatrician at Sunway Specialist Center Damansara. So today, basically, we're going to talk about COVID-19 in children, and I think it's quite timely that we speak about this, especially when the cases are rising in Malaysia. So first up, COVID-19, as we all know, is a virus that spreads easily amongst people, especially in crowded and confined spaces. And we all know that it affects all various age groups. You may have seen in television lately that the daily cases could be anywhere from like 2,000 to 3,000, and quite a lot of them are in Klang Valley at the moment, and hence why there's the second lockdown of the MCO. So first up, in children, quite interestingly, kids actually seem to be less susceptible to the infection. So basically, even if they catch the virus and if they do have the infection, they are either going to be asymptomatic or they may have a milder version of the symptoms. So that's quite thankful. And in fact, I think I've just looked up on press statements by our DG Health that the cases of COVID-19 in children, basically those under the age of 18 years old, there are roughly about 9% of that in all the total cases that we have so far. And this is based on a statement that was back in October 2020. So I don't have like the latest figures as to how many of the children are affected by this at the moment, directly of course. And we also know that, in fact, due to school closures, it is quite hard to tell if there is spread within school communities and as well as attending schools. But that is something that we need to be mindful of course. In terms of how people do catch the virus, we all know that it's through droplets and through the air. So if anyone is in close contact with somebody who has the virus, it could be basically transmitted through coughing, sneezing, just even by talking, and as well as breathing quite hard. So I guess some people might be thinking about, what sort of symptoms should we be looking out for if a child is suspected to have COVID-19? In fact, we do know that most of the symptoms that can occur in children are very similar to adults. They do present with fever, cough, could also have runny nose, sore throat. They could actually be feeling really tired. They may have muscle aches if they're old enough to tell you so. And they may also have some loss of appetite or loss of sense of smell or taste if they are in the older age group too. Some kids, surprisingly, they have some manifestations that look like a diarrhea infection. So they may have vomiting, diarrhea, a tummy ache, and some of them actually just look really miserable and irritable, and they are just unsettled with excessive crying. So that could be in the younger age group. In terms of how long is the incubation period, it is the same as adults as well. So if they have had contact with somebody who is COVID-19 positive, the presentation of symptoms could range anywhere from like day 5 to day 7, and of course it could last much longer as well. So like adults, we do have a leeway of 10 to 14 days if there was any presentation of symptoms of COVID-19. Most of the kids, as I mentioned before, thankfully they don't get really sick, so we don't see a lot of them. We have had we have seen reports and case studies since the beginning of the pandemic all across the world where this particular illness can rarely present in a severe stage. And in kids, there is a special phenomenon called the MIS-C. So that's basically multi-system inflammatory syndrome in children, or in some other countries, it is also called as PIMS, PIMS, Pediatric Inflammatory Multisystem Syndrome. So in this particular severe illness, they usually present roughly about a few weeks down the track after contracting or after being infected with COVID-19. So these kids, they can actually look very sick. In this particular syndrome itself, or this particular condition, it looks like Kawasaki disease. So hence, back in the early days of pandemic, some clinicians thought that it was Kawasaki disease, but in fact it is actually related to COVID-19 infection. So this particular syndrome, how it appears is there is a hyper-inflammatory state of certain organs in their bodies, and over time they may actually start to fail, and that can lead to a very serious consequence. Then that's very, very rare. Like we don't see many of that, thankfully, but we do need to be aware of it just in case if it does happen. So these kids, they can present with shock, or they look like they've collapsed. They may have a very low blood pressure, or they may even have they look like they have rashes all over their body. They may have red eyes, red lips, and also something called a strawberry thumb. And the worst case in this particular syndrome is some of them can actually cause an effect onto their heart, to their lungs, and as well as to their gut and kidneys. So it is something to be mindful of, but luckily we don't see many of that at all. So next commonly asked question would be, when and at what age should kids be wearing masks? I think in the very beginning of the pandemic, we all have no idea about this, and we have no idea about COVID-19, so we're all learning from it from time to time. In fact, I think in the very, very beginning of the pandemic, people have been advising and recommending kids above the age of 2 years old to start wearing masks, especially when you're outdoors in public, in crowded spaces. But there are newer evidence, basically, especially from WHO and as well as UNICEF. All these organizations and these bodies have even suggested to actually be to suggest that kids over the age of 6 years old to start wearing masks when they're outdoor in public spaces and crowded spaces. Those under the age of 5 years, they do not necessarily need to wear masks, especially because if they have problems with complying with it. So if they have trouble trying to keep it on, they would be fighting against it. Or even for the really younger age kids, they might even have trouble trying to breathe through the mask, and they may probably even suffocate from wearing masks. So it can be a dangerous thing. For kids anywhere between the age of 6 to 11 years old, it is advisable that someone supervises them when they're wearing masks, so that they are wearing it in the right fit, in the right manner, and being compliant with it, of course, and making sure that when they're removing it or putting them on, to practice hand hygiene, so that they are not spreading the germs and spreading the virus everywhere. So I guess the other thing is, if they do have certain type of difficulties breathing through the mask, it can be quite difficult to tell. And I get one of the ways to look out for it is if you notice that they're breathing much faster, they look like they're coughing, look like they might be choking, or if they look like they're looking a bit quiet and a bit inactive, you might be wondering, oh, hang on, maybe they are having some trouble. And of course, if they turn to a different color, then that's obviously the worst case scenario of all. Throughout this whole entire time of the pandemic, and it's been going on for nearly a year now, especially since the outbreak in February for us in Malaysia, it has brought upon a lot of indirect impacts, of course. And I think families, parents, teachers, everyone would understand that children are indirectly impacted by COVID-19 if they haven't been affected by it directly. So, what I'm talking about basically is things like they are missing out on school, they are missing out, meeting their friends, they miss socializing with others. They are also having, I guess, their own lives are being turned upside down purely because of the uncertainty of COVID-19. And they're also having trouble with, I guess, learning, and as well as meeting their schedules, and some of them are missing out on their doctor's appointments, missing out on their vaccinations, which are all important. To date, I think that there are increasing number of reports of kids who are actually losing motivation, especially in turning up for classes, joining online sessions. And in fact, there are also increasing reports of domestic violence and as well as child abuse, which that is a very sad thing about the COVID-19 pandemic that has brought upon us. So on that note, how do we then keep it positive, and how do we cope with this pandemic when we're all stuck at home? How do we basically try and motivate our kids again? And I think the most important thing is us as parents to actually be role models for them. So basically modeling coping strategies, modeling, trying to find ways of having some positivity in the house. So, you know, trying to use praise, avoid using any negative words. So for instance, like, you know, you could say things like, oh, can you please put the clothes into the bag, or put the clothes into the to the washing machine or something, or please put the toys back into the cupboards, as opposed to being the negative way, such as don't put this here, don't put this there, don't leave it away, you know. So using positive words rather than negative ones can be helpful. Praise them along the way is also another positive way as well. So especially if kids were doing something that is something that you know that it is something small, something tiny, such as, or they've, you know, put the dishes away into the sink, and then that's when, you know, just praise them and just say, oh, that's such good work, that's really amazing, you know, thanks for putting the dishes away for me. Other ways of keeping it positive really is to try and create a calm environment for them. And I think especially when kids are actually studying at home at the moment, it is important for everyone in the household to create a schedule. So basically set routines, create a timetable for everyone, make sure they know what their roles are, share responsibilities between your partners, and, you know, understand that sometimes, you know, things don't go your way because, you know, we need to have some flexibility in life. So there needs to be some sort of routine, but it needs to be flexible. I guess the other thing to be mindful of is make sure that you have time for your own self. So when things don't go your way, don't beat up yourself. You know, take a step back. Understand that, you know, you do need to look after yourself before you look after others. So understand that, you know, there may be times where you need to take a break, have your own me time, look for things that makes you, you know, be happy about, or, you know, do something that actually you find yourself, you know, that makes you happy. You do something that is, I guess, something that you know that will make kids happy as well. So things like, if you know that your kids love cooking or baking, or if they like reading, or they like dancing or singing, you know, have a karaoke session, you know, after finishing their schoolwork, for instance. So give them something to look forward to at the end of the day. So some sort of incentive. And of course, like if they are, you know, I guess behaving bad, or they might not necessarily be behaving that way because they are throwing a tantrum and they're trying to make you angry. It's just sometimes things just don't go their way as well. So, you know, they might be angry about something, they might be worried about something, or they might be anxious about something. So I guess, you know, just being there for them, ask them how they're feeling, you know, listen to them, be able to explain to them why this is all happening as well, because some of them might not actually be able to understand what it all means. And as well, as I said, trying to basically get some sort of incentive reward system, like stickers, and, you know, at the end of, you know, I guess 10 or 20 stickers, you get a prize or something. So, you know, trying to be creative in that sense. So at the end of the day, I think that we all need to basically stay safe, make sure that everyone maintain their own hand hygiene, make sure that, you know, avoid crowded places if possible, you know, be mindful of each other, be mindful that this is hard times that everyone is going through, and also, you know, if there is some possibility, and if there's anything, just you know, have fun with each other while you're at home. So, you know, make the most out of it and actually just have fun. And I think in the end of the day, you know, we will all go through this together. I know this is just tough times, and it might seem like it's a very, very long dry spell, a long drought, but we will all get through this in the end of the day. And lastly, just to basically say that, you know, don't forget to attend your doctor's appointments, and as well as any other schedules that you might have with your own doctor. Don't forget your vaccinations for sure. It does take time after you've had your vaccination that the vaccine will work. So don't forget your own schedule. Check your kids' record book just to see whether they've missed anything or if there's something else. And if you're not sure about anything, please give us a call. We're open, and we all follow SOPs in this center as well. So just come by and just say hi to us. So I might actually stop there, and I'll just see if there's any particular questions or anything that I might be able to answer. Thanks, Michelle, for saying that it's a very helpful information. Hi, Lisan. So one of the questions is, are there any types of masks to avoid? I guess for kids, wearing N95 can be very difficult because it can feel very suffocating, especially even for adults wearing it. So I think that for kids, it's best to use a medical grade mask like the one that I'm wearing at the moment, which is like a 3-ply mask. For kids, especially if they're much younger, so as I mentioned before, if you are younger than 5 years old, you might consider wearing face shields. If schools do reopen eventually, there might be consideration, of course, of thinking about, maybe I should be getting them to wear a face shield just for extra protection. That could be an option. But of course, face masks, anyone from 6 years and above should be considered wearing them. 6 to 11 years, it's when you need some supervision just to make sure that they're wearing it appropriately and not having, any breathing difficulties or suffocation from it. And 12 years old and above, you have to wear them like adults. So I think there's no question for that. I think surprisingly, when we look at the SOPs for schools, it just mentions something about, I think if you are sick and unwell, that's when teachers and as well as school nurses would be providing you with a face mask if you actually do have symptoms, while waiting for parents to pick them up. But it's not quite clear at this stage as to whether all kids are mandatory to be wearing masks, especially if you are 12 years and above. So that's one. Yes, it is a good idea for karaoke session and dancing, and I think it's a great way to get some exercise in. And I think that's the other thing, getting exercise in during your daily routine. It's a good way to basically get your health in check, making sure that you're doing something physical, some sort of physical activity together with your kids is always important. Don't forget that just with exercising, you are also helping to release some endorphins and have some happy hormones in your blood system, so that's also a good thing. How can we book our appointments? So basically you can go to our website and that's Sunway's Specialist Center Damansara to actually book our appointment. There is actually a WhatsApp number there as well that you can book through to us. Otherwise, the number to call is 0364119191. So that's 0364119191. So another question that we have is it okay to postpone my child's vaccination for now? I think it depends on how long ago the last vaccination was, and if, say for instance, I'll just give you a quick example. Say if your child is 12 months old and they are due for a 12 months immunization, then if it's postponed for a month or maximum probably 2 months or so, I think that's okay. That's still reasonable. So a month, postponing it after a month, that's okay. But yeah, just don't forget to catch up on your immunizations after all this is over as well. Yep. Cool. So yeah, we are open, and I think just a little bit about Sunway Specialist Center Damansara. We are actually an ambulatory care service, so we do outpatients and as well as day surgery, mind you. So day surgery and as well as outpatient service. We actually don't admit any COVID-19 patients. We do COVID-19 screening tests, and that's in a separate section. So I guess anyone who's coming in for screening tests, it's in a different section. They use a different entrance. and in fact there is a drive-through screening at the moment as well, so there's very little, in fact no contact at all to the public and to the patients who are coming in to see doctors for their appointments in the clinic here. Yeah. No problems, Shamili. That's not a problem at all. Cool. I think that's probably the end of our Facebook Live session. So you can let us know if there's any other topics that you wanted to talk about. You know, you can just put that on the comments down below. But yeah, I hope everyone stays safe. And yeah, be nice, be kind to yourself, especially during these times. All right, thanks. Bye.